Dietary recommendations for people with anemia. Anemia is a medical condition characterized by a reduced number of red blood cells or a decreased ability of the blood to carry an adequate amount of oxygen to the body's tissues. Red blood cells contain hemoglobin, a protein that binds to oxygen and carries it from the lungs to the rest of the body. Anemia can result from a variety of underlying causes, and its symptoms and severity can vary depending on the cause and how rapidly it develops. The common causes of anemia include iron deficiency anemia. This is the most common type of anemia. It occurs when the body doesn't have enough iron to produce adequate hemoglobin. Causes can include poor dietary intake of iron, blood loss, such as from heavy menstrual periods or gastrointestinal bleeding, or difficulty absorbing iron. Vitamin deficiency anemia. Deficiencies in essential vitamins like vitamin B12 and folic acid can lead to anemia. These vitamins are necessary for the production of red blood cells. Hemolytic anemia. This type of anemia occurs when the body destroys red blood cells faster than it can produce them. It can be inherited or acquired and may result from autoimmune conditions, certain medications, or infections. Aplastic anemia. Aplastic anemia is a rare condition where the bone marrow fails to produce enough blood cells, including red blood cells. It can be caused by radiation, chemotherapy, toxins, or certain medications. Chronic diseases. Certain chronic diseases like chronic kidney disease, cancer, and inflammatory disorders can lead to anemia by interfering with the body's ability to produce red blood cells. Hemoglobinopathies. Genetic conditions like sickle cell anemia and thalassemia can result in abnormal hemoglobin production and lead to anemia. Common symptoms of anemia can include fatigue, weakness, pale skin, shortness of breath, dizziness, cold hands and feet, headaches, and an increased heart rate. The specific symptoms and their severity can vary depending on the type and cause of anemia. Iron is available in two forms, heme iron and non-heme iron, and heme iron is typically more readily absorbed by the body compared to non-heme iron. Heme iron. Heme iron is found in animal-based foods, particularly in red meat, poultry, and fish. It is the more easily absorbed form of iron because it is bound to hemoglobin, a molecule that plays a central role in carrying oxygen in the blood. The heme iron in these foods is generally well absorbed and contributes significantly to your body's iron stores. Non-heme iron. Non-heme iron is found in both animal and plant-based foods, but it is less efficiently absorbed than heme iron. It is found in foods like plant-based sources of iron, e.g., lentils, beans, tofu, fortified cereals, as well as in eggs and dairy products. Non-heme iron absorption can be influenced by various factors, including the presence of other dietary components. To enhance the absorption of iron, you can eat lean proteins. Incorporate lean protein sources like poultry, fish, and lean cuts of red meat. These foods contain heme iron, which is more readily absorbed by the body. Plant-based sources contain non-heme iron and include beans, lentils, chickpeas, spinach, kale, tofu, and fortified cereals. Consuming these with vitamin C-rich foods, like citrus fruits, oranges, lemons, grapefruits, strawberries, broccoli or bell peppers, can enhance iron absorption. For instance, you can add citrus slices to a salad containing spinach or other iron-rich leafy greens. Choose whole grains. Opt for whole grains like brown rice, quinoa, and whole wheat bread, as they provide more nutrients, including iron, compared to refined grains. Consume leafy greens. Leafy greens like spinach, kale, and collard greens are rich in iron. They also contain other essential nutrients, including folate and vitamin B6, which are important for red blood cell production. Include nuts and seeds. Nuts and seeds, such as almonds, pumpkin seeds, and sunflower seeds, are good sources of iron and can be a part of your diet. Avoid iron blockers. Certain foods and drinks can hinder iron absorption. Tannins. Found in coffee, black tea, the highest concentration, green tea, the lowest, and cacao, moderate. Tannins are heat stable, which means they are not destroyed when you heat them up. Calcium. Especially from calcium supplements or dairy products when consumed with iron-rich foods. Phytates. Found in grains and legumes. Soaking, fermenting, or sprouting these foods can help reduce the phytate content and improve iron absorption. If you consume these, try to separate them from iron-rich meals. Consider iron supplements. In some cases, your healthcare providers may recommend iron supplements. Some of them may cause gastrointestinal disturbances, so it is important to follow their guidance on dosage and timing. Cooking in cast iron cookware can increase the iron content of your meals, especially when preparing acidic foods like tomato sauce. Vitamin B12 and folate. Ensure you're getting an adequate amount of vitamin B12, found in animal products, and folate, found in green leafy vegetables and fortified cereals, as these are crucial for the production of red blood cells. Stay hydrated. Dehydration can make anemia symptoms worse. Drink plenty of water to help your body function optimally. Remember that it's essential to consult with a healthcare professional for a proper diagnosis and personalized guidance on managing anemia. They can perform tests to determine the cause and severity of your anemia and provide appropriate treatment recommendations, which may include dietary changes, supplements, or other interventions. Thanks for watching. Please subscribe.